wà ní kílì yẹn tó wà ní
lọ́lẹ̀ mi ti lè dé kémi sọ yẹn sẹ́yìn. Wípé kò fẹ́ kí ní ìkọ̀ yẹn.
Hello?
díẹ̀ náà ló dúdú bí ayé òyìnbó ni dá. Aṣọ ajá láti ilẹ̀ gbó máa gùn dé dẹ́rẹ́bà gan lórí ìjókòó. Ó mọ dáná ìfẹ́ bí jì. Bọ́ọ̀lù àwọn òjò bá yọ àti mọ́tò.
Once again, welcome you to the Lagos State Secretariat Car Park. This is the venue for the event I'm sure you all know. The event is the formal launch of the new MICU, we call it MICU, that is Mobile Intensive Care Unit. They are ambulances, I'm sure you can see that, and they are mobile hospitals, so to say, mobile hospitals as it is well equipped and with quality staffing. Governor of Lagos State, the person of Alhaji Lateef Kayode Jakande. He's not the Haji, but please put your hands together for Papa Jakande. You're welcome, sir.
Káàbọ̀ sórí ìjókòó, yèyí ọba ti ìlú Ìkìrun, ìgbàsàkímọ́gà ìjọba fún ọ látọwọ́ torí Ọlọ́run.
Gang. So definitely he is the leader of the gang, isn't it? Gang, the chairman has committee on health, Chairman Honorable Sami and Honorable Wale Dia Fred Yowadi Absahi. That's not all. The other members of the gang will join us, and as soon as they do, I will definitely let you meet them. The Institute from UK is also here with us. His name is medicine because he is in the medical field. Please welcome Mr. Alan Medcraft. Yes. Various health institutions in Lagos State, they are all seated there. From also this is my name, boss.
Láfikún, lára àwọn tí owó bàbá sọ̀rọ̀ ń bí lónìí tí ó tura pé a kú oríire láti ní àwọn ẹlẹ́kajẹ̀ka ilé iṣẹ́ gbogbo ní ìpínlẹ̀ yìí ṣé ẹ̀yin náà mọ̀ pé bíire bá kan ni ṣe làárẹ̀ ni tí bá ní yọ̀ pé.
We are inspired by this. Race has reached accidents in the lives of Nigerians on daily basis on our roads, regardless of age, gender, or social standing. Many prominent citizens, young and old, have fallen victims to this national catastrophe. Many children have become orphans without bargaining for it. Many women are being made to shoulder responsibilities beyond their immediate source as a result of the demise of their venue. According to a report of the Federal Road Safety Commission, 7,000 people lost their lives from road accidents in Nigeria in the year 2003. 26,000 injuries were recorded. Between 1960, the year of independence, and 2001, 926,666 accidents occurred on Nigerian roads. There were 25,874 deaths, while 796,538 sustained injuries. How long shall we continue to mourn the passing away of valuable men and women in our midst as a result of auto accidents? This tragic state of our roads is the principal reason why St. George's Ambulance Emergency Foundation was formed to complement the inestimable service of the Lagos State government. The foundation will, however, go beyond the boundaries of Lagos State. We have identified 10 accident-prone areas in the federation: Lokoja, Akure, Isua, Okene, Lagos, Ibadan, Benin, Sagami, Port Harcourt, Enugu, Lekki, Abuja, Kaduna, Ilorin, Mokwa, Ibadan, Ife, Enugu, Odisha. It is our intention to provide emergency service in all these roads. Once again, we congratulate you on this issue and we assure you of our total commitment to the task of saving lives on our roads on which we have embarked. May the Almighty God bless our endeavors. Èmi àwọn èèyàn wa àmìjọba wọ́n ti gbàdúrà gbogbo ìfàṣẹ ìgbàgbọ́ mọ́tòkọ́lọ́ ìgbàlẹ́ gbogbo èkó lórí àgbàdo.
At preventing unnecessary deaths with the Permanent Secretary, Dr. Idris, and all officers for the untiring commitment to delivering health care to all in Lagos State. For us in the Red Cross, we appreciate the flag of Lagos in Nigeria. We use this chance to appeal to the Lagos State government's generosity. We believe in the large-heartedness of His Excellency Governor Bola Ahmed Tinubu. Once again, we say congratulations and we wish you success. Thank you.
The highest number of vehicle density in Nigeria, which implies that road crashes and the attendant destruction of life will be on the high side in the state. Therefore, the establishment of Latin under Dr. Bola Ahmed Tinubu administration is a timely intervention in providing preventive care to accident victims with penetrating injuries, broken limbs, spinal cord injuries, burns, and other wounds, which will be compounded by confused crowds. Igbákejì wọn Ọ̀túnba Fẹ́mi Pedro abẹnugan lẹ́gbẹ̀ẹ́ àtọ́mọ tuntun pọmọ tiẹ̀ tí ó ti pọmọ ọ̀hún dàgbà tó sì jẹ́ pé kọ̀ọ̀kan èdè èyí tó máa ń tọ́jú wọn lónìí o Ọlọ́run wá ṣe ọmọ tiẹ̀ ló wá ń pọ̀ báyọ̀ lọ́wọ́ Aláàjà Àbíbátù Mọ́gàjí àti gbogbo àwọn adarí ètò pátápátá àti àwọn ọba aláyé àti gbogbo ọ̀dọ́ àdúgbò ìjọba àti pàápàá wọn lè ṣe.
The good messages from some of our stakeholders. Because we have standing behind me is the national coordinator for the St. George's Ambulance Foundation, Engineer Adam Hamza. The President of the Foundation has listened to you about invite us to this occasion.
first legislation and public sector from 27 to 28th of July 2004. The constancy of excellent treatment to accident victims. We urge the Lagos State government to take advantage of this workshop by sending in their vaccine funds. We urge the Lagos State government to support the effort of Civil Blast Foundation and other government organizations that are in this noble cause of saving lives. Once again, we congratulate His Excellency, the Governor Asiwaju Ahmed Bola Tinubu, and pray that God will continue to strengthen you and effort to return to Lagos State to every expressway, very close to the junction, around the fantasy. I thank God for the Abra Foundation. And we take them to General Hospital, but they refuse that God is there. They have that. So, to the Duro Sule Hospital and the Kenya.
Ẹ̀jẹ̀ iwájú àwọn ẹ̀jẹ̀ yìí wò sáré ewu tó bá sì lójú òkú ìgbọ̀dọ̀ sí ọ̀nà rẹ̀. Wọ́n ń lo àwòkọ́ṣe ìjọba ìpínlẹ̀ Èkó fún ìtẹ̀síwájú irú nǹkan báyìí níjọba ìbílẹ̀ wọn. Wọ́n jà fún àwọn lọ́gàlọ́gà lẹ́nu iṣẹ́ ọba àti àwọn èèyàn jàǹkànjàǹkàn láàyè kan lẹ́kọ̀ọ́ lórí báwo la tẹ̀ ṣe ń ṣe ìtọ́jú ẹni tí ìjàmbá kọ́ hàn tàbí tó bá ṣùgbà díẹ̀. Ìjàmbá náà ṣẹlẹ̀ sí àwọn fẹ́ gbé wọn lọ ilé ìwòsàn gbogbogbò ṣùgbọ́n àwọn èèyàn wọ̀nyí kọ̀ pé àwọn lọ ilé ìwòsàn gbogbogbò.
The Excellency, the Deputy, and the Honorable Speaker, and other distinguished guests, to this effort-making commissioning ceremony of our new mobile intensive care units, which actually are moving hospitals, and I mean advanced hospitals on wheels in Lagos State. These mobile intensive care units have been procured by your government to strengthen and take health care delivery to much higher and much more safer levels in Lagos State. First of all, today's occasion is another practical demonstration of your administration's commitment to the health sector reform agenda of the World Health Organization, of which management of emergencies, accidents, trauma cases, and generally distress situations are an integral part. Secondly, acquisition of these state-of-the-art ambulances and mobile intensive care centers by your administration is a feat worthy of commendation, and it even calls for celebrations for certain salient reasons which I will enumerate. Prior to the inception of this administration in 1999, a few Peugeot transport ambulances without necessary accessories and communication facilities were purchased by previous administration. Few other Peugeot Boxer ambulances that were fairly equipped but non-intensive were also purchased. However, these assisted for some time, but they were nowhere near the needs, and certainly nothing compared to the vision of Your Excellency for what we want to call the health sector of Your Excellent State. About the third quarter of year 2000, Your Excellency had made firm and clear decisions on the reorganization of accident and emergency services at our two major centers in Lagos and Ikeja. More specifically, you made certain broad policy decisions that accident victims and indeed any distressed patients in Lagos State must, as a matter of policy and deliberate policy, be snatched from the jaws of death without any question as to his social or financial status. You made it clear that that was a debt your administration owes the citizens of Lagos State, and you therefore made definite steps to ensure the implementation of this policy. The first was to declare that emergency service must be free for the first 24 hours,
no matter the status of that person. Without any questions asked, such a person must be safe, whatever may be his cause. Therefore, from wherever that person may come from Nigeria, be he a Hausa man, Igbo man, Yoruba man, or anywhere at all, once he has come into the shores of Lagos State, whether he is at the outskirts of Shagamu or the Ibadan Express Road to the areas of Ekpe and beyond, once he comes into Lagos State, he is sure that he will be snatched from the jaws of death without any questions asked at all. In order to strengthen and ensure this policy is carried out, you therefore ensure that ambulance points were created as strategic points all across Lagos State to reduce the response time in such a way that ambulances will not be taken off from the hospitals and be getting stuck in the hold-ups and traffic hold-ups. Therefore, they were strategically placed at points such a way that they could easily be accessible to the ordinary man on the streets, who could call them either by phone or by merely going to them to call them to rescue life. This marks the first time in the history of Nigeria that such a scheme will ever be put in place. It was well commended all over the country and even beyond. At international levels, it continued to be cited as the first of its kind in the entire West African subsector. However, you were still not satisfied. You therefore decided to embark that on your second term in office, you will ensure that the healthcare delivery front was elevated again beyond just the level of having transport ambulances. And that has culminated in what we are doing today in your procurement of 20, the first 10 of which are being delivered today, of not just ambulances, but mobile intensive care units that are actually mobile hospitals. They contain facilities over and above what virtually any hospital in the public sector in Nigeria contains. Indeed, Your Excellency, considering the rate of deaths on our roads, the need for these ambulances can never be overemphasized. More importantly, that for these mobile intensive care units is the fact that they can also be called upon to save lives in the homes, in people who are in distress. This, your foresight, must be highly commended. And indeed, it is therefore no surprise that various state governments have been falling over themselves to try and copy and emulate this your laudable step. They continue to make it clear, they accept that in the health sector, you continue to be in the forefront and you continue to be the leader in the entire Nigerian firmament. Your Excellency, it is obvious that the financial outlay of this program is likely to increase with provision of even another 10 new ones, which you have already ordered for. Permit me to say that your name will have been written in gold with these your people-oriented programs in all sectors in Lagos State. You have, with your kindness and humility, left indelible marks in the sands of time with your high regard for human lives, and may God continue to bless you. Your Excellency, let me quickly add that throughout the length and breadth of Nigeria, these types of mobile intensive care units have not yet been acquired by any other government, whether federal or state. I wish to seize the opportunity to let Your Excellency and the good people of Lagos State know that the Ministry of Health and all other members of the health sector appreciate this your support, this your visionary step, this your forward-looking vision in ensuring that the health sector continues to be in the forefront. I want to seize the opportunity to pledge that the entire health sector will not let you or your government or the people of Lagos State down. We will continue to make sure that these strikes are not only felt by the people of Lagos State, the total commitment and dedication that it needs will certainly be given. More importantly, we shall continue to cherish these state-of-the-art intensive care centers, and we will continue to make sure that they are optimally functional, they are result-oriented, and we will make sure that they are well maintained. I wish to publicly place on record once more the firm support that the entire health sector has continued to enjoy from you and the entire state cabinet and the legislature. We are very proud of you, and may God continue to guide and strengthen you in your unique service to humanity. I thank you.
Yes. Latamos, bẹ́ẹ̀ni, àwọn ní ambulance yẹn. 1, 2, 3, God, 1, 2, 3. Hello. Ṣé ambulance services yẹn? Ẹjọ́, there's an accident. Tinubu square, please come. Thank you. An ambulance will be sent there now. An ambulance will come now. Just calm down. Last two, please take a message.
He's calling the nearest ambulance to the scene.
Please, I just got a report now that an accident has just occurred at Tinubu Square involving an 18-passenger bus. I want you to please proceed there immediately. Confirm reading. Thank you. For expecting your report. Over.
Have you heard that, Sarah?
Jerry, what's in there?
she's the one that is least injured, and that is why she can feel the pain. The helpless patient is the one that cannot communicate at all, and that's the one they are concentrating on. That's the essence of triad. If you are knowledgeable, if you know what to do, you really know that the helpless patient that doesn't come for help is the one that you should concentrate on. Look at these nurses are just wonderful. They are marvelous. They are even using slings. They've already diagnosed the patient to have simple fracture. They are treating the patient with a certain. I'm telling you, we are in Lagos State. We are not in America, neither are we in Europe, but Lagos State. Cousin of Asiwaju, he has a vision that has now become a mission. He has people in his cabinet that are equal to his staff, and that is why he has this practical demonstration. He has so many people here that are benefiting from Lagos State and that look at what they are doing. That is what they want to help from. I want you to concentrate on the head nurse. I want you to concentrate on the head nurse. She's not really the head on the patient. And yet, the patient has been sterilized. There's really nothing that will happen to the patient again. The patient is not enough. The patient has cervical collapse. The patient has sleep. And there's food going on. Tell me, ladies and gentlemen, what set of this patient is? This patient has been revived. This patient is not going to die. This patient is going to survive without complication. The next patient will be attended to. She has minor bruises. Nothing will happen to her. You will see her now. And that's when you know the essence of triad. Triad is very good anywhere in the world. Where there's mass casualty, you have to sort out the patients that really need first care. And that is what they are now doing. You can see, they are taking her down inside the ambulance. You can see, yes, she was the one that was really shouting. You can see now that she's now walking into the ambulance. Yes, that helpless patient is in there. She's in there, and she's in there. And I'm telling you, before you say, the patient will be up and down without any complication. This is a complicated section. Now you see this section. Now you see this section. Anywhere in the world, if you want to,
Ajá ò lè ṣe bí ẹ̀kọ́ láéláé. February ó yàtọ̀ sí July. Ìkọ́sí ló kan. Gómìnà tó ń bí ìkọ́sí ìjọba ìlú ìpàwọ́ àtàwọn gómìnà tó láàrin ẹ̀sìn gbogbo.
The pilot is doing a good job. The pilot has got out this pilot. You use robotic technique to move a patient as a unit because the spinal cord is a very delicate organ and must not be damaged. If it is not damaged, the patient will not suffer from any paralysis. You can see how they are making use of the pattern bar. They are being interlaced. And now, can you see what the pilot is doing? Excellent! This is splendid! I'm telling you, it's unique. You don't see any of this. I'm telling you, Asiwaju, I don't know that orúkọ máa ń ròyàn according to people. Aṣọ́rúkọ ló máa ń ròyìn. Asiwaju, you always be Asiwaju.
Nǹkan tára ní fẹ́ là ń fẹ́. Kìí ṣèjọba aláriwo lásán lásán. Kò sí nǹkan tó dáa ní pé kí àwọn máa lérí.
Asiwaju, you always be Asiwaju. We are always faithful. We are the originator where others follow. Lagos State has always been known as sector of excellence, and that is what you can see now. They are executing their children. It's unique. They are serving the patient so that the patient does not sustain any injury. Can you see that? Actually, I'm saying that you are just too much. Now you people.
Gbogbo irinṣẹ́ tó péye ló ń bẹ nínú ọkọ̀ yìí láti fi ṣe ìtọ́jú àwọn tó dàbí ẹni pé ó kún nínú ara ẹni yìí wọ́n sì máa gbé wọn.
Máa wọlé.
Give a testimony that I survived a very ghastly motor accident right on this road, this popular 7-Up road, about 2 years ago. And I will first thank Asiwaju Bola Ahmed Tinubu, if not for his initiation, to bring about the Latsenbos and Latsens, who were on time to rescue me from the jaws of death. That fateful Friday, I finished my work as the press officer in the press room of the Ministry of Information and Strategy precisely, and I was on my way home about 6:30 to 7 when a driver, a commercial vehicle, was coming right behind me, and apparently his brakes failed, so he hit me from the back and I became unconscious, and I hit the trees, those large trees on the way. So that was what happened, and from there I didn't know anything. I was unconscious. Then I was later told that the Vice Chancellor of LASU, Professor Abisogunli, made a call to the Latsens. I think they were along the express there. So they were prompt. They took me to Lagos State Ikeja General Hospital, where I was there. I was bedridden for 3 months, and I was attended to very well. I was given intensive care. So I sincerely again want to thank Asiwaju again, and join me in thanking him for his initiation of this laudable program. And I hope, and I don't pray anybody witnesses this, and I believe if any other person witnesses this as well, they will also be there to help that person at the appropriate time. I thank you once again, sir.
Ẹni ọ̀lẹ́ ṣe sùúrù kọ́ wá ní àwọn ọmọ tèmi yóò tó gbọ́ ẹ̀ tó sùúrù. Ẹni ọ̀lẹ́ yìí sùúrù ẹ̀ ọmọ méjì kí ló dé ọmọ méjì yá ọmọ méjì.
ṣe nífẹ̀ẹ́ àwọn aráàlú fún iṣẹ́ tí wọ́n ti ṣe sílẹ̀ yìí tí a bá rẹ̀ ń tí jàǹbá ṣẹlẹ̀ sí nínú ilé àbíkẹ́ ẹ̀rí kó dédé dákú ni ẹ má gbé tó ọmọ ìlú sílẹ̀ ni.
ẹ máa gbọ́kàn yín lọ àlàáfíà ti tó ti dájú fún wọn ẹ̀ ní sanwó fún 24 hours fún ogún ó lé mẹ́rin ó lé ẹ̀ ní sanwó kò tẹ̀lé lórí ìkọ̀ọ̀kan ẹ̀ tó ń lọ lé oògùn gbogbo ẹ̀ ọ̀fẹ́ ni.
Lulu, ọkọ mi fẹ́ pé ìlú Tinubu lárábìnrin yìí tó. Òun ní kánà ní road accident. Òun ní kánà ní ohun injury. Ọlọ́mọ àbẹ̀ ṣe gẹ̀. Orí kan tèmi rò pé arábìnrin yẹn akọni pé ọ̀pẹ̀lọpẹ̀ Bọ́lá, ọ̀pẹ̀lọpẹ̀ rẹ̀. Ayé ìbáyẹyẹ mi ọ̀pẹ̀lọpẹ̀ rẹ̀, ọ̀pẹ̀lọpẹ̀ Bọ́lá, ọ̀pẹ̀lọpẹ̀ rẹ̀. Ayé ìbáyẹyẹ mi ọ̀pẹ̀lọpẹ̀ rẹ̀. Thank you very much. Well, we have just another demonstration, practical demonstration of the home injury thing. The first one had a head injury, that is the first practical demonstration we had on the road today. Fracture of the left lower limb and was very unfortunate. Of course, you can see they were revived, taken to the hospital, and of course they will be back here.
On the provision of these state-of-the-art mobile intensive care units. These units have been procured by Lagos State to augment the Luxembourg ambulance services. As you will see from the demonstrations, that this is not only a vehicle to carry sick, ill or traumatized patients, but actually to be able to deliver medical care at the site of the incidents. You would see from the demonstrations that the vehicles are kitted with not only diagnostic equipment, but also resuscitation equipment, which will enable the driver as an assistant, the nurses, and the doctors administer emergency health care at the site of an accident. These vehicles are built on a Mercedes-Benz chassis for durability. They're diesel engines for fuel consumption and for economical fuel consumption, and also to reduce the running cost of the vehicles. As a part of this exercise, we have an intensive training program which only started 2 days ago for the drivers, the nurses and the doctors to be able to administer and improve their skills. I'm happy to have next to me the president of the Ambulance Training Institute of the UK, Mr. Alan Medcroft, who is also here as part of the 4-man team of experienced resuscitation training. To say a word with your permission, sir.
Your Excellency the Governor, distinguished guests, I am absolutely proud and honoured to be here. The Ambulance Service Institute is an international organisation, and the staff we have come to train and meet are very professional. They're learning all the new techniques. They have up-to-date equipment which any country would be very proud of. I certainly would like to have these ambulances in London with me, and I would certainly like to have some of the staff. Their dedication in taking in the training and learning has been outstanding, and I thank you very much.
Sugar level for cases of diabetic coma. You will have a pulse oximeter, a digital pulse oximeter, which will also monitor the pulse of the patient and also check the oxygen levels, especially in situations where you might suspect that the oxygen level of the blood is low. We have doctors' kits and nurses' kits for not only the treatment of patients, but also for minor surgical procedures that might be required at the site of an accident. In some instances, you might have to do an emergency tracheostomy, which is to get access to the windpipe so that we can breathe for the patient while we transport him to the hospital. We also have, as you have seen, the comprehensive new pack resuscitation kit,
This is a kit that is very portable, can be carried along, not only used at the site, but also in the truck.
In the history of this administration, in our story, our total commitment to quality of life, prevention of unnecessary death, commitment to the social welfare, not only of this great state of Lagos, but the entire nation. More so, as they travel from one point to the other, particularly on our highways, as they approach Lagos, our services are not limited to the Lagos state boundary alone. It has cut across our neighboring states. And we've heard, by the grace of God Almighty, to have assisted many people. I cannot be giving you the statistics right away, but what is the essence of a government if it cannot give a total commitment and service to its people? The people who elected you, or those who voted for you but did not vote for you, they equally deserve proper attention. And that's what we are doing, to show you what a difference from a dictatorship to a very virile, enduring, consistent, democratic governance. Our healthcare, from the hospital down to tertiary institutions, from clinic, we have demonstrated the very essence of the philosophy of our government, which is to use the machinery of power for the pursuit of the welfare and happiness of men and women, young and old, who live in Lagos and the suburb. The strategy adopted by our government in translating this philosophy into practice is to seek the greatest good for the greatest number. It does not and cannot matter to us whether you are a Christian or a Muslim. It does not and cannot matter to us whether you are in AD, PDP, ANPP, CNP, or any other of the new parties. It does not matter and cannot matter to us whether you are an Hausa, Yoruba, or Igbo, or Kanuri, or Ishan, or Itakwa. Such divisions may naturally manifest during the search for votes, but once the majority is outspoken, once the people have consciously and thoroughly decided the best applicant for the job, and that is myself, elected rigorously, the governor must put his hand on the plow. Election decision has been made and deliver services that will promote the well-being of the Commonwealth, regardless of the partisan politics. This has been our guiding light, and we have consistently been doing this. Anybody, any person can easily go through